How does palilalia affect kids with Tourette syndrome? Imagine trying to have a normal conversation, but your words keep repeating involuntarily. That's what children with Tourette syndrome sometimes experience with palilalia. It's a type of vocal tic where they repeat their own words or phrases over and over without meaning to. This can happen suddenly and often without warning. Palilalia is part of the neurological symptoms seen in Tourette syndrome, which involves involuntary movements and sounds. When kids have palilalia, it can make speaking clearly more difficult. They might struggle to get their thoughts across because their speech gets interrupted by repetitions. This can be confusing for others and sometimes frustrating for the child. Emotionally, kids with palilalia might feel embarrassed or self-conscious when their repetitions happen in front of friends or classmates. This can lead to feelings of frustration or anxiety. Because they cannot control it, they might worry about being judged or misunderstood. These feelings can affect their confidence and make social interactions more challenging. Understanding that palilalia is a neurological symptom helps caregivers and teachers support children better. It's not something they do on purpose. Recognizing this can reduce feelings of shame and help create a more accepting environment. Supporting emotional regulation is key. Teaching kids ways to manage their frustration or anxiety can make a big difference. Using behavioral therapies like comprehensive behavioral intervention for tics can help reduce how often palilalia occurs. These therapies teach children coping strategies and help them develop better control over their tics. Encouraging social skills and confidence-building activities can also help children feel more comfortable and less isolated. Sometimes, speech therapy is helpful if palilalia significantly affects communication. Speech therapists can work with children to improve their speech clarity and help them find ways to express themselves more easily. Overall, with patience, understanding, and proper support, children with Tourette syndrome and palilalia can learn to manage their symptoms and build resilience. Their emotional health and communication skills can improve, making everyday interactions less stressful and more positive.